Chickenpox is actually a very common childhood disease, but there have been less cases since more and more children have begun getting the vaccination. There is a vaccine available and it can be given to small children and adults alike, but there have been known cases of where children do get chickenpox after they've received the vaccine, but the case is usually shorter and more mild. So it's still always worth getting the vaccination. Now, chickenpox usually lasts about 5 days, and it's usually associated with a fever, and the worse the rash, the higher the fever. And the rash will go through about 5 different stages, and the child will normally have a ton of different blisters and sores all over their body going through various stages at once because they can continue to get new sores during that 5-day period. And they start out with small red bumps, and then they become thin-walled water blisters. Then they turn to cloudy blisters, then open sores, and then dry brown crusts. A lot of parents want to know when they can take their children back to school or let them interact with other kids. And it's usually not a problem once all the sores have crusted over and the child doesn't have a fever. A lot of parents want to know, when did my child get this, and when were they, or where were they exposed? And actually the incubation period can be 10 to 21 days. And so your child can be exposed, 2 to 3 weeks before they actually start to show signs of symptoms. If you're ever concerned at any point during the course of the chickenpox, it's always best to call the doctor and have your child checked out. But there are a few specific reasons why you'd want to call. If your child has an extremely high fever, if your child is just looking and acting very sick, is very lethargic and isn't eating well, or is vomiting and isn't able to keep food or fluids down, those would all be reasons to go to the doctor and to be seen as soon as possible. Also, some kids have chronic infections like lung problems, heart problems, and you probably want to have them seen because their bodies may not tolerate illness as well as a child who doesn't have pre-existing chronic conditions. Your child is likely to itch a lot when they get chickenpox, but there are a few things you can do at home to help. Give your child a lukewarm bath and discourage itching as much as possible because that will actually make the sores worse. And you can use different calamine lotions, Benadryls, and call your doctor for over-the-counter medications that are safe for your child's age and weight. It would also be best to give your child a soft diet because their stomachs might be a little bit irritated while they're sick. So yogurt, pudding, those kinds of things that their body doesn't have to work very hard at digesting. And lots of liquids are best. If you'd like to see more tips like this each week, be sure to like our Facebook page, subscribe to our posts, and share us with your friends and family.